Good morning and welcome to another edition of What's News in Healthcare Social Media. I'm Kathy Brown of Brown Knows Social Media, and today my guest is Casey Quinlan, the great Mighty Casey, you might know her as on Twitter. And Casey, would you like to say hello?
Hello, everyone out there in Google Plus Hangout on Airland.
I was tongue-tied because Casey and I were in a great conversation just now when we realized it was 11 o'clock, so we had to cut in mid-sentence so we could air live. There's so much conversation already going on before we even get started that we're going to have to rehash some of this, Casey, because I'm sure...
Oh, absolutely. But you know me, I talk for a living, so, press the button. Win a prize.
Well, I love talking about social communication with Casey in the conversation because Casey does a lot in the Twitter sphere where I'm more in Google+, and she represents more the patient base where I'm more with the healthcare professionals, and when we come together we make magic and we really round each other out. So I'm looking forward to this conversation, and it just so happens, Casey, that the articles we picked for today are right in your sweet spot, and many of them focus around Twitter, hashtags, all those things that we all should know about. So I'm looking forward to us both sharing our thoughts on this.
Well, amen. And full disclosure, I teach social media, and I'm not just an e-patient, just carrying an e-patient message, although that is the central part of what I do. I teach social media, and I also work with clients, largely in healthcare, but sometimes in education and some other spheres. And I also work with clients on building social presence. So not everybody needs to be on Twitter. I'll say that first. But second of all, if you are looking to drive a message, Twitter is a good place to do it, or it's a good place to make part of your communication quiver, another arrow in your communication quiver.
Well, and I know this isn't a part of the articles that we're talking about, but I'm going to ask the question because I do have you here, and you do talk mostly, I don't want to say talk mostly to patients, but that is your target audience. You are one, you understand them, you go where they are. Where are patients communicating?
Well, patients are communicating often in condition-specific communities, say hashtag BICSM or hashtag LCSM, lung cancer social media, hashtag HICSM, HCSM, which is what we're talking about here, run by Dana Lewis, is a massive Twitter community. But because hashtags have become more useful in other social platforms, say Facebook and obviously Google+, that the use of hashtags, which was exclusive to Twitter for quite some time, is no longer exclusive. And since Google appears to be sort of, I don't know, capturing and managing and reporting on that taxonomy, knowing about hashtags, which started with Twitter, is now sort of a web thing. It's not just on Twitter. So understanding how to use hashtags is important.
Yeah, hashtags are really a way of indexing your conversation in the social realm. It's a way of giving it a category and a way to come back to it easily, that if someone knows they're interested in a certain hashtag, they can search, and all the platforms use hashtags now.
Yeah, and if somebody's curious about hashtags, whatever industry they're in, really doesn't matter. They could be plumbers. But they should go out, think about who is an influencer in their industry, and go out and particularly look at their Twitter stream if they are on Twitter, and see what hashtags they're using, because that will give everybody else in that industry a clue about how to anchor their conversations.
Yeah, and because the people who are the influencers and who successfully establish those hashtags, they really do set the stage. They set the rules on how to communicate in that topic.
Yeah, and if you want to attract the attention of an influencer, that's one of the things that would be a way to do it, other than just opening a conversation, which is powerful in and of itself. But to continue to be on someone's radar who's an influencer, particularly if it's a hashtag that they started, and there's ways to kind of like track that back and see. But I think that using hashtags judiciously, we have that conversation. If you use more than 2 or 3 hashtags in something, you better be making fun of hashtags, or I'm probably going to stop listening to you. But that's a story for another day.
Well, let's dive right in. I was going to talk about the Google article first of the URLs, but I think I'm going to You know what? Let's just get that out of the way, because I know you and I are going to we're going to be going a lot over Twitter. So let's talk about the 10 URLs that every Google user should know first, because that's really the only topic that doesn't kind of flow into this whole Twitter and hashtag thing. And there's not a lot I want to say about it, except that I thought this was an absolutely fabulous article by Digital Inspiration that shared 10 really good URLs that some of which I knew existed, and some I forgot about, and some I never knew. Did you take a look at those?
I did, and I was, wow! There were a bunch of things that I didn't know. There were obviously some that I did, because both you and I are pretty heavy Google users one way or another. But I did not know about sign up without Gmail, but frankly, because I have so many Gmail addresses, most of them client-related, but I also, my basic Gmail address, or my basic presence is via Gmail. The sign up without Gmail, I didn't need it, but I thought, wow, that's a very useful tool. And there's ways to set preferences. There's a way to export your data. This is a terrific, meaty list of URLs, and I really think that anybody who's on the web at all could get a heck of a lot out of this list.
Yes. Well, and some of them aren't going to be useful from a business point of view, but it's interesting to see just how much Google knows about you and to be able to correct the things that they think they know about you, because I didn't realize that Google tries to guess things about you.
Really? You didn't know that?
No, I didn't. I didn't think they just flat out made it up.
For contextual content presentation.
Well, they were so off with me. They were so off with me, and now I know why, because I went into that link. Number 2 is a link where you can see how Google has profiled you, and you can correct that profile if it's incorrect. And when I went in there, they had me set up for all kinds of TV shows and movies, and I have no idea where they got that stuff, because if anybody knows me, I cannot sit through a movie. I have no desire to go to a movie. I never watch TV, and if I had it my way, we wouldn't own a TV. So they were so far off on that, but getting back to some of them that are a little more useful. The Google.com/takeout was a really good one. You mentioned that already.
That's huge, because it's a way that you can archive your data, and yourself, and find out, find out what kind of content archive you've created, and have it yourself in case, I don't know, Google ever implodes. I can't imagine that they would implode, but. And that, the legal one is one that I thought was particularly interesting, because there's a lot of conversation now. There's a guy on Facebook, and I know you're not on Facebook, but there's a guy on Facebook who kind of took over. I didn't see him because, hello, I know how to filter, but apparently the guy, his last name's Ellis. He's some exercise guy, but he was basically stealing content and posting it under his own, and he ended up with like millions of followers, and it was quite the little, Facebook storm in a teacup for like 5 minutes last week sometime. But legal, the support.google.com/legal is a way that you can quickly look at putting in a DMCA complaint with Google to get content that belongs to you removed from someone else's site. So anybody whose stuff got stolen by this Ellis guy, definitely hit up google.com/legal.
Mm-hmm. Yeah, that's a great one. So we're going to move on now, but I provide the links to all the articles that we're talking about today, and this is the first one that I provide, and I suggest you go through there and just check out some of those links and see if you don't find some of them as interesting, if not useful, as I do. So let's move into Twitter now, and this same website, I'm really starting to love Digital Inspiration. I was hoping to get the author of this website to join us in today's discussion to talk about this Twitter article, but I couldn't get his attention, so I'm hoping that afterwards enough people will chastise him that he'll actually come out and join me another time for another discussion. I won't say his name. He is the author that shall remain nameless, but you can find his name on the site.
Yeah, well, let's just go to the About Us, which I'm looking at right now, and he is in India, so you're gonna have to do, somebody's gonna have to do some clock math.
Well, now he can't be in bed right now.
Probably not, but who knows?
Yeah, well, I'm going to be going to India in a week and a half, so maybe I'll just hunt him down.
You need to reach out to him and tell him you're going to, I mean, it's not as though that's a tiny country. It's not like you're going to Rhode Island. But, definitely, I'm so envious. Just the food. Oh my God, I love. Anyway, so
We only
going
have
to
a half
lots
hour,
of,
so we'll have to have that conversation off
yeah,
air.
no. Just take a lot of pictures.
So the article that I want to talk about, we're going to talk about Twitter hashtags, and these all run together. But there's a great article that is on this blog. It's a Twitter search trick you didn't know about, and it's a trick on how to use. I'm trying to think if it's the tweet. This is the TweetDeck one, where you can search for hashtags and engagement, things that are getting a lot of it.
Well, it shows. He talks about it being a tweet deck tool, but it's not. Since TweetDeck is owned by Twitter, I believe I'm not smoking, blowing smoke up my own skirt. I think that Twitter bought TweetDeck. I think that the search strings which are in this article will work in the search box on Twitter. You don't have to be on TweetDeck. And the reason I say that is I don't use TweetDeck myself. I use a different platform. I use Hootsuite.
No, actually, the article mentioned, and I looked, I didn't find it, unless somebody can correct me. I don't think you can do this on Twitter. You can only do it through TweetDeck.
Well,
Which is
that's a bummer.
Yes, but TweetDeck was kind of the stepchild of Twitter. TweetDeck was a powerful engine until Twitter took it over, and they really didn't give it the love. And I'm not sure if they bought it out so that they just had control over it.
My pushback on TweetDeck has always been why I don't want to use anything that I have to download a piece of software to use. And because TweetDeck rides on Adobe Air, I'm not a happy camper with that. So that was one of the myriad of reasons that, including computer failure, whatever. But I ended up on Hootsuite for some very specific reasons that made business sense to me, and I have not regretted that choice. So
now,
there you go.
I have toggled between the two, and it's been a while since I've been visiting TweetDeck because you're right, we had the Adobe Air and the Java conflict and all that stuff, and I got tired of dealing with it. But when I went to recheck it out with this article, you can use TweetDeck on your desktop. You don't have to download it anymore.
So it is now a web service versus a Okay, well that's good to know.
Yes, and so I did go through these steps, and it was very easy. I simply clicked the plus icon on the left sidebar. It opened up a search, a new column for me to select a search, and I selected a search, and then one of the options was engagement, and then you can put in, I only want to know those that are at least 10 retweets or 10 whatever. So it really is a nice additional tool that you can use in addition to whatever analytics. And that brings me to the question one of our viewers has asked, and that is Michael Roberts would like us to address, what kind of tools could someone use to determine who started a hashtag?
Well, that's a rabbit hole, but
let's go down it.
But I think we could find that rabbit if you wanted to. If it's a healthcare-related hashtag, that's easy. Just go to simplor.com and check it out. If you're looking for hashtags that are not registered with Simplor, then one tool that you can use, although I haven't used it as much to look and see who started it, but I look for it, I use it to seek frequency and to seek hashtags at all, is Hashtagify Me, and I know I shared that link with you, Kathy, so you could put it into the tools for the, or the links for the folks who are either watching now or who might be looking at this later.
I'm so ahead of you. They're both there now.
Good for you. See, I'm looking at my browser and not looking at you, so, oh, there you are. Hi. And I'm trying not to look like a complete schnert while I'm looking at my, it's like, okay, I'm going to just read here and you're going to watch me. Oh, that's boring. But I think that there's a lot of ways on Hashtagify Me that one could go and look. There are 3 free tools, related hashtags, top influencers, and usage patterns. If you want to get some in-depth intel, you have to sign up for their pro version, which I have not done yet. But I may. One never knows. But I do like Hashtagify Me, and I use it when I'm teaching social because I don't teach strictly healthcare social, and depending on if I'm putting together a custom class for a corporation and they're in, say, the financial industry, a Simplor is not going to make any difference to them unless they're talking about their employee health plan, and then I'll try to talk them out of offering their employees health benefits because I would like to see that end, and we should all be buying our own insurance, but that's a topic for another day. I can hear the screaming now, and I'm probably going to get beat up on Twitter any second now. But there you go.
Well, let's talk a little bit more about using Twitter specifically and hashtags specifically. If a hospital marketer, communicator is wanting to really understand where to begin and what the value is, can you give kind of a synopsis of where to begin, that whole concept of what they can be doing?
Okay, well, I'll start by sharing my philosophy and approach when it comes to Twitter. I see Twitter as a great way to, because I come from a broadcasting background, I was in network news for 20 plus years, and I still am a media producer. Because I come from a broadcasting background, I see Twitter as a great way to, it's kind of like the headlines. It's, you know, it's like, and I look for information and share it with my audience, and there are several hashtags that I use. All of them are health related, pretty much. Although I will go, if it's something else, I'll look on Hashtagify Me to see if there's something that should be used. But Twitter is a great way to share the headlines. Sort of think of it as, you know, headline news. And you want to send out information to the community that you talk to or who follows you about the stuff that you're known for sharing. And that's where people need to start thinking about, like, okay, what do I want to be known for? What is my point? What is the message I'm trying to share? Now, when you said hospitals, and I think that hospitals are overlooking a really good possibility of, because the hospitals and, you know, the entire healthcare system is in a cultural shift right now. And I think that one of the ways that hospitals can continue to be not only as relevant as they have been, but to become even more relevant over time, is to, rather than look at what's happening inside their building, i.e. we have Da Vinci, we have this doctor, we have, you know, specific to conditions or a specific treatment, to look at creating themselves as the anchor spot for all community health issues and for all community health. Because healthcare needs to shift its focus away from, hi, we're the place where the sick people go when they're sick, but if you're healthy, you don't, you know, you kind of, you know, healthy people don't hear healthcare messages if they think that healthcare is what happens over there to sick people. But hospitals have a huge opportunity right now, and the healthcare industry in general, to say, hey, it's not about if you're sick, it's about avoiding being sick, or get, you know, and also, yes, getting back to healthy if you do get sick. But we're the place to find out all the good, trustworthy, scientifically based, evidence-based medicine approaches to whatever. Everything from keeping your kids and yourself healthy to how to deal with, you know, whether or not there's something going on in the community, like there's flu hotspots during flu season. I mean, just, there's a lot of opportunity there. So to get started on Twitter, I would recommend that you obviously think about what the message, who it is you want to talk to, and are they on Twitter? If they're not on Twitter, well, then you don't need to be on Twitter, whatever it is you're doing. But if you are looking to send out, you know, headline messages and have, you know, and kick off conversations with your desired audience, Twitter's a great way to do it, and hashtags are a great way to anchor that conversation. Conversations.
Now there's the hard question, and this is a question that Dave Williams had asked, so I want to get to this. And he says, I really haven't grasped the value of tweeting versus the time investment. So I want to address the question of what is the return on investment on Twitter. Obviously, you just mentioned that you can get out there and reach people before they get sick, but there's still the question of what is that return on investment. My answer to that would be that Twitter is a part of your presence that will play a part in your visibility and your ranking on the search engines. So one of the first things you should consider is the more places you are and the more places you engage and get people to engage with you. That is one benefit of using Twitter. But Casey, can you answer the question, when you tweet something out there, you have to expect people to do something with it, or you have to expect to have a result. What is the result that you think is the benefit in this case?
Well, you know, one of the things that I say to people is, like, you know, who question social media at all, and here I go with my morning coughing fit, but the people who question social media at all, and, you know, it could be Twitter, it could be Facebook, could be LinkedIn, could be Google+. Sorry, this happens. It's just a dust allergy, folks. but it gets exciting sometimes. If you have an advertising budget, or you spend a lot of time creating brochures, or you spend a lot of time putting together events to support your message and the business that you are involved in, if not using social media, and including Twitter, means that there are community conversations happening that either you're not listening to, which is not good, or that you're not participating in, which is disastrous. So if you think in terms of ROI, think in terms of like how you measure metrics on who saw your ad. But the thing is, you don't have to wait for reports from your media buying group to tell you like how many times it ran. And then, by the way, guess what? They're mostly just guessing based on Arbitron and Nielsen, information on that channel. So it's not like they know that Fred McMurray over on I Street saw that. They don't know that. They have a percentage. So as the shift from traditional media to social media has gone on over the last 5 to 8 years, the amount of money that you spend on marketing should, I would say, be at least 60-40 social versus traditional. But I can hear the screaming. People are going to start yelling at me. But if you think of Twitter as being, again, the headlines, and then stuff like Facebook or Google Plus or LinkedIn, depending on the audience and whether you're B2C or B2B, and like, again, sharing more in-depth content there, and all of it anchored back to your home spot, your website. So the time investment, you need to figure out how much time you're spending on marketing already, and how, if you can carve some of that off to do a pilot on some social platforms and see what kind of conversations you have. See if there's a change in where the money is coming from and where the attention is coming from and who's walking in the door if you have a door, or your virtual door if you don't have a physical door. But there's not a one answer for this, but what are you doing now to get customers? And how can you incorporate social media pilot ideas to try to see if it's worth it for you to do this? You have to, you have to jump in and try it. But you also have, there's a lot of management tools, like, Hootsuite is the one that I use. But there's also even more advanced tools that cost a lot of money.
Well, I want to go into a tool now, because you just gave a perfect segue into the next article, and that is the Social Media Examiner article on how to use a Twitter analytics, which I had forgotten I set mine up, because I don't actively use Twitter. I use Twitter, but a lot of what I do is either automatically connected, or I go out on Twitter only for very specific things I want to post out there. I'm really not using Twitter as well as I used to, because I find so much more of my audience on Google+. But I want to show
hot with Wing Spouse, baby. That's how I found you back in the day.
Yeah, that's true. Yep, and I'm still Wing Spouse there too. I just don't.
I know. Now you're a clever kibitzer.
But I want to show people something here. The article that I'm referring to on the Social Media Examiner talks about this Twitter analytical tool. I'm going to share my screen here because I want people to see something that I think is very significant. This is my Twitter activity, and like I said, I don't show Twitter a lot of love, so I don't have any impressive scores. I'll be the first one to admit that. Now, the article mentions you can sort it by engagement. I have not found a way to do that, so I don't know if that article is outdated, they took it away, or if I'm just not figuring it out. But here's what I noticed. When I started looking at the impressions, and whoops, I just did that again, didn't I? When I started looking at the impressions and I scroll down here, they're all pretty much the same. They're not exciting numbers until I thought, well, let's find out who my really good, these are all Hangouts on Air for the most part. That's the only thing I use it for. So I thought, let's find out who my really impressive guests were that brought me the most engagement. And do you know who ended up topping my list? I'm trying to find it here.
Yeah, it's back up. I saw it scroll by. Look for the 900.
I know, it's what I'm looking for. I guess my eyes
saw it go by.
I thought it
did. We're watching.
There it is.
Oh, there it is. Whoop,
right here.
Yeah, guess who?
When Casey was my guest.
I honestly, it's not me. It's that hashtag. It's ePatience.
And
I really do think that it was e-patients.
and that's
Although it could have been me. I mean, yeah, I don't, yeah, who knows? But it really, the world is not all about me. I actually know that.
so
But
what does this result tell us? I'll tell you what it told me. It told me that you're a really good guest to have on a hangout. And it told me
hi,
that,
kids.
and it told me that when it comes to patients, they're on Twitter, because that was a topic that really was addressing something that patients were interested in. We talked about crowdsourcing and crowdfunding and a lot of things for patients that wanted to be active in their health, and that significantly drew up the engagement and everything else. So there
Yeah.
are things to be learned about when to be on Twitter and when to show love to Twitter versus some other areas, and I think that
Right,
this.
and to go back to the question that was asked, and I can't remember the guy's name. I apologize. That happens to everybody. You know, that's why name tags were invented. But the question about he's not sure about the ROI on Twitter. But you know, again, until you go and do a little research, and obviously, you know your business better than I do. But to understand what message it is you're trying to put out, who you're trying to talk to, if they're on Twitter, who are the influencers, and then figure out how you would want to press a message there. It's like anything else. You know, you won't know if it works until you do some kind of a pilot test, but you want to be as both strategic and tactical as possible in putting that together. So think in terms of sort of charting out like how customers get to you now, what you know about that, and then do a pilot on maybe a couple things. You know, try Twitter and something else. But again, depending on what your business model is and who it is, you know, who your audience is. But give it a try, and if it doesn't work, well then, okay, it doesn't work, so don't do it.
Mhm.
But if it does work, figure out how to put that in your mix of how you interact with your community.
So I've just posted the link on the event page for viewers to come join us live. So if you are a viewer and you're able to join us live and join this conversation, look on the event page for that link and you should find it. The last article that we're going to talk about is by Sprout Social, and it's how the healthcare industry is using Vine to engage patients.
Ah, yes, Vine, the latest shiny object. I think that Vine is a cute tool. It's a way to engage with youth because you know it's like Instagram, that the greater percentage of people using that platform are, say, under 30. And it's a great way. A lot of comedians are using Vine because, I mean, it's very short, 6 seconds, and you can stitch together a couple of 6-second things, but basically these are 6-second videos. And there's a couple on that article. The one that I found most entertaining was the guy who was exercising while getting chemo. Go, dude! Really, you know, that was impressive, having been through chemo. But I think that there's ways that organizations, healthcare and others, can do crowdsourced content by inviting their community to submit vines, you know, tied to a specific event or topic.
Or hashtag.
Well, event topic hashtag. Event topic hashtag. If your event doesn't have a hashtag, does it exist?
Yeah, it's one thing to have a hospital try to get permission to include a patient in a Vine, but when you ask your community to submit
if the patient sends you the Vine and says, go ahead and use it, guess what? You have got HIPAA consent.
That's right, that's right. And so this really skips some of the hard work that you'd have to do otherwise to pull something together yourself if patients would be involved in it. But
you know, and you know, speaking again of HIPAA, if you want to bake in a double, triple, you know, belt and suspenders move on the submission engine page, have a checkbox that says yes, I agree, and you know, release, you know, HIPAA. You know, call David Harlow if you want to know the right words to use. But you know, put something in, you know, bake it into the submission engine that says, yeah, you have permission to use this.
well, actually on Vine, and I'm not an attorney here, but with Vine, once you post it, it's out there for the public anyway. You've already given the public permission to see it, and there's a built-in thing they've added recently that you can embed it in other sites, no different than YouTube. So once it's out there, it can be embedded by anyone. So I would be surprised if there's any legal issues if they provided the hashtag. Now, if they haven't said I was a patient at this hospital and I'm participating in this.
Well, yeah, I mean, I think that a hospital could, again, double, triple protect itself, or,
Yeah.
healthcare practice, by, say, they were going to announce winners, then, ahead of announcing the winners, they would connect with the winners and say, okay, could you just check this box for us? Or,
Yes. Yes, because you wouldn't want to inadvertently identify a patient who had not identified him or herself as your patient, because
right.
that could be misconstrued.
If you're, like Cancer Fighter on, on Vine, but your real name is, Fred McMurray, ask, do you want to be known as Fred McMurray or Cancer Fighter? Okay, Cancer Fighter, and then, just link to the Vine profile. That's it. You don't need to say who it is beyond that.
Yeah, yeah, but it would be interesting to do a campaign where you would ask people to use a hashtag like conquering cancer and have them summarize what they're doing.
Yeah, and I mean, I'm working on a project like that right now in the city where I live, that is tied to preventing, well, not preventing, but sort of healthier communities, and it's around drug and alcohol prevention with youth, and healthy, being healthier, preventing teen pregnancy. There's a lot of mental health stuff. There's a lot of different moving parts. But my plan, because our target is the under 21 crowd, I plan on doing a crowdsourced content campaign using a lot, Instagram, Vine, Facebook, Twitter, the usual suspects. But part of the research I'm doing now is there's a city hashtag. That's easy. But then to try to figure out what kind of hashtags might penetrate. So, stay tuned for updates.
Well, there are some benefits and there are some things to know that are negatives about Vine. First of all, you can't take things out of Vine and put them into YouTube. You can't repurpose them in other content. So they're stuck in Vine, and they're not as SEO compatible, shall I say. It's not like YouTube where it's completely searchable and it hits the search engines like you would with YouTube. However, Vine really is one of the platforms of choice with the younger generation. So if you're trying to involve the younger generation, Vine might be a great way to bring it to a platform that they're familiar with.
Yeah.
So those are some things to consider. So I hope that Cheryl Ducey, I hope that we gave you some answers. She posted earlier that she was interested in our discussion about Vine, and so I look forward to seeing if that spawns any ideas. I do want to tell everyone that after looking at some of the Vine samples that are online, I am putting together a write-up, a blog post, specifically on effective ways that healthcare bodies have used Vine, and I'm going to give some samples there. So check out brownnose.com in the next, probably I'm going to finish it tonight and post it tomorrow, and you'll be able to see some samples of some really interesting ways that they have been used effectively. I was quite impressed once I dug around, but you have to use your creativity, and you have to be you have to be entertaining. You can't be boring.
Yeah,
don't.
Yeah, in 6 seconds. I mean, that's not a lot of time. That's basically a punchline. Get a punchline out there.
All right, well, we have one viewer joining us today, and that is Sheila Strover. And Sheila Strover there's two of her right now, but I think I can pull the real one. Are you the real Sheila Strover?
Hi, Sheila. Good to see you.
Hi there.
Do you have any comments or questions?
Yeah, I just wanted to say that I had just gone on to Simpler to have a look at things. I get very distracted when I'm watching events, and I forget to turn off my mute. To mute my thing. But I've found that I seem to have been accredited with the hashtag knee. Now, what is that? I mean, that's for me very powerful. But what does it mean to me to be the one who started it off?
Bragging rights.
Obviously.
Bragging rights.
Oh,
and
okay.
But I think that I mean that shows to me, beyond that it was you, Sheila, who did this. It shows to me the power of having an industry archive like Simplor, where those who do create movements, messages, etc., within that industry, who are influencers, can can both vet and be proven as influencers, because the taxonomy is archived. So good for you, and I'm not surprised it was you for knee. and congratulations.
It's
Okay.
I find it interesting that
So you get
you
a pat on the back, basically.
well, Sheila, you
Well, yeah, but plus, I mean, you're the influencer. You created it. You were the first one there, and you know, maybe impressions might have driven up by somebody else, but you are the you know the OG or the ONE.
So
Yep.
I'm sure it was used before I ever used it, but it's the first person who registered it on Simpler that gets the credit.
Yep.
Bit like publication, yeah. Okay.
Yep. And Sheila, I have something to share with you. I've been waiting and hoping that you would pop in because when we were talking about using Vine, there was a recent, they got a lot of attention. The University of Colorado Health System, I think is their title, they did a series of Vine videos showing knee surgery. And I'm sharing that link. There are some articles covering them, and I think they must have done a little bit of a promotion press release sort of campaign because they were all over once they did this, and it was called live tweeting. So I'm putting that link on the event page, but if you haven't seen it, you should check it out. It's really quite close up. Were you aware? Were you aware of it, Sheila?
No, no.
So maybe you should create some Vine.
I never really looked at Vine before today. I was just looking at your links. It's good that your links are not Hangout links, because when I come half an hour before the event and then I find there's a 1 hour Hangout you've suggested we look at, then I can't see it all before the event begins. I think you've lost one of your panelists.
Well, somebody came in and then went out, so you know it happens.
They probably did what I did and forgot to mute themselves because it makes a terrific noise. Did it make a terrific noise your end?
Wasn't too
No, I mean
bad.
I heard them, but then they went away, or you know, then the sound went away. So who knows?
Good. Well, I'm not going to go to Simpler and add every single word I can think of, but.
Well, but it's a process, and you have to say, you know, you have to submit it, and then it has to be approved. So I know that that Tom and Auden are, you know, somewhat rigorous about the, you know, thumbs up, thumbs down. So you know, I'm sure that there's a lot of spam bot behavior that they have to put an umbrella up against. But you know, I'm glad they do it. We never see it.
I will say that Simpler is the hashtag project is a great place specifically to put your hashtags for a conference. If you're having a health conference of any kind, not health care, but even health, whether it's a walkathon or anything else that you're doing, if you have a hashtag for that, make sure you get it registered with Simpler ahead of time so that you can use that hashtag before the event takes place and during the event, and all of that will be contained within Simpler. And it also gives people a place to verify that that is the right hashtag to use as well.
Yeah.
Yep. Well, I wonder if we're going to get the other person. I didn't see who it was that was trying to pop in, so I hope that
something or other. But you know, I'm not sure. It should show up, shouldn't it? Well, anyway, it should show up in one of those you know, sidebar drills. But
so while we're talking about Twitter and we're talking about hashtags, Casey, I'm going to ask you the question: do you have any little tidbit tip, anything special that you do that you think you do regarding Twitter or hashtags or analytics or tracking that you think is just an oh, by the way, did you know, that you can share with our viewing audience today?
Well, my usual role, ROLL, is to hashtag everything I do put out, because not everything, you know, everything on Facebook does not have a hashtag for me, but most of it does. Pretty much everything on Twitter, with the exception of a couple things. And it's because of the anchoring the conversation. It's like, would you want to go and watch political news on ESPN? No. So it's sort of like, don't, you know, I'd rather tag things so that people who follow me or people who might follow me who are involved in the conversations that I want to be involved in know what I'm talking about. And I think that's true for anybody. So using hashtags, if you do nothing else in social, do some research into hashtags in your industry and anchor your communications that way, because that way you won't be shouting down a well.
Well, and my tip would be, before you post something on Twitter, think about the audience that's going to see that tweet, where they're going to be, and what they're going to do with it. And as Sheila mentioned when I was sharing the hangout last week, I thought that was a really good hangout, and I thought it would be interesting to add some dimension by bringing in some content that was happening on Google+. But what I realized was, you're right, anybody who's outside of Google+ wouldn't be able to easily follow that particular piece of content. And it's the same way with Twitter. If you're going to share something on Twitter, when I share this hangout on Twitter, I don't share the event page. I share the YouTube link, because I know that people who are on Twitter might not be on Google+, and they might not have access or easy access to that event page, but everybody can get to YouTube even if they're not signed in. So think about the links you're sharing. If you want to share a picture, maybe it shouldn't reside on Pinterest. Maybe it should reside somewhere else. By the way, here's another by the way thing. When you have Vine videos, when you have YouTube videos, those can be shared on Pinterest on a board. Pinterest is not just for photos.
I did not know that. I mean, not as though I'm terribly surprised, but that's
videos on my board.
You say you do, Sheila?
I have YouTube videos.
Yes, I do too. But I hadn't thought about how you would share Vine, but now it's so easy to go to a Vine and you can just go over to share, and then there's a choice of embed or whatever that link is. And one of the tricks that the article said was, when you go to if you find it shared on Twitter, or if you're the one who created it, share it on Twitter, and that creates a link. And that is the link that you use to post it on your Pinterest board. So you can do that. You can share all those. So you can cross-populate a lot of your things by having a Pinterest board that also includes your Vines and your videos. You can have a YouTube channel that includes your videos. You can have a Twitter channel that shares all those different links. There's really a way to get people from all those different areas and then send them to your website or to your YouTube channel to get them where you want them to go and act.
Yeah.
Cool.
Well, that kind of summarizes it up.
Yes, it does.
Okay. Well, we are coming to the end. It is just coming up on 11:42, so I'm going to go ahead and wrap up today, because I think we've tied a nice bow on this.
I think we've done it.
And Sheila, thank you for joining us again today. It's always a pleasure when you come and join the conversation for the last bit.
I waited for Scott, but he didn't pitch up.
Yeah. Maybe he had a late night.
Yeah.
And Casey, thank you for joining me and sharing all of your wisdom, both in social media and from your e-patient standpoint, and just from your sassy little self. And this concludes this week's edition of What's News in Healthcare Social Media with me, Kathy Brown, and guest Casey Quinlan. See you next week.